I am Dr. B K Kunwar, Professor and Head of the Department of Neurology, SC Medical Quarter. I am retired for last 4 years. I am doing my practice in neurology. Today, we are going to discuss about a topic which is called first aid in epilepsy. This is every year being observed because the Purple Day, which is being celebrated on 26th March of every year by WHO. This is called Purple Day or Epilepsy Day. Now we are celebrating that Purple Day and we are discussing some of the topics which is essential for the common people that they should know what is epilepsy. Epilepsy, as you know, is a very common problem and is a common disease. But if the common people were aware of it, they can know what is to be done when these epileptic attacks occurs. Now, who are the people to be selected so that they should know what should to do during the attack? Now, these are the persons which are very close to the patients, like the friends, members of the family, and the relatives, and also to the person who are in working surroundings, and the school, most likely the teachers, because majority of the epilepsy attacks occurs in childhood age group. So we must educate all these people for epilepsy and how to take care of the epileptic patient during an attack. Now, as you know, these people, they should learn how to know the epilepsy when the child or the patient is having an epileptic attack. What are the symptoms? What are the signs? They must be aware of it. What are those symptoms and signs? Now, if a patient becomes little staring look or looks like to one side being staring to outside, or if the child or the patient is having a mental confusion or having altered sensorium or having twitching movements of lips, mouth, or any part having body jerks, or he is wandering, or maybe having a poor response to your commands, then one should think of that probably this patient is going to have an epileptic attack. Now one should suspect this. Now what are your duty that you should do? Immediately you take certain steps. So then we discuss what are those things that we should do during these attacks and what are the things we should not do during the attacks. Now if you ask me what are the things to do, is first thing is that you don't get panic. Don't have any fear for the attacks. Be calm, quiet, and tell others to be quiet and tell them, explain them what is this, what is the epileptic attack and how it is going to be done and how it is going to be furious during the attack. Then see the patient may not fall to the ground because the patient may fall and injure himself. So you try to hold the patient and slowly, calmly make him down on the bed. And then find out what are the objects is there. Because there are maybe some sharp objects, there may be some blunt objects. The patient may fall and produce injury. And then you see to the surroundings. What are there once the patient is lying down. Try to lose the dress, try to lose the tie, the shoe, the socks, and also to the belt which is there with the patient. And then give a very good push up to the head so that there will not be any head injury. Then ask the patient when the patient is lying down, do not leave him. It takes a long time because 1 or 2 minutes to be there. Then the patient calms down and goes to sleep. And you have to stay there because you can't leave the patient at this stage. And at the same time, once the patient becomes conscious, now your duty is to give an identity card because this identity card will help the patient to identify that he is an epileptic patient. Whenever there is an epileptic attack, and everybody can know that this is an epilepsy, and they can give a call to the persons, the relations, they can give a call to anybody that can give us a help for ambulance or anything else. So you must have an identity card where the name of the patient, where the address of the patient, the phone number of the patient as well as the telephone number of the relative should be there. Then what are the things we should not do? This is very important because we do not know what is going to happen. So during that period, you try to remain calm, don't ask others to become panic, don't shout because that also produces some fear among others also. Then ask the persons to not to give any fluid, because that gives rise to swallowing problem, and because the patient is not able to swallow at that time, he is unconscious. Now if you give water or any fluid, at that time it may produce aspiration and pneumonia. Some people do whatever they like, they could take because there may be a tongue bite, so people give a spoon inside the mouth. Don't do that, because that is a hard object that may produce injury to the patient. And at the same time, don't give a mouth guard, because if you keep some cloth or some gauze put in the mouth, it may produce also asphyxia. So don't do this. And when the patient is having a violent movements, try to hold it. Don't try to forcefully hold it, because that may produce injury and fracture of the body parts or bones. So allow the patient to calmly sleep, and you just hold it very calmly. At the end of this session, the patient will have very calmly come up, respiration will be recovered, and the patient will try to look at you. So what you do is, now once the patient epileptic attack is over, and ask the patient to sit down, and you can have a call to ambulance, and then you can send the patient to the hospital. But don't get any panic or any noise there, so that people will cluster around the epileptic patient. And as your duty, 2 to 3 minutes is very essential, and your presence is very essential. So all these things, what I say is only a first aid measure. It should be done whenever a epileptic patient and an attack is going on. You may find on the road, or you may find at home, you may find in the school also, in the office also. So it is our duty that to make all the people who do not know what epilepsy, they must aware of it. And this awareness is a very important part of this Purple Day, and we must carry out, because as you know, epilepsy is a very curable disease. If you take care of these patients, they will not produce any injury. They will not have, like sometimes if the attack occurs in the water, in the near place of fire. So that is the area where they may produce injury, and maybe the very life danger may be there. So that part one should take care of. And that at the end I must thank that this is a day, where a Purple Day, where one should be aware of all these people with epilepsy, also a common problem like epilepsy, and they should know what is epilepsy. They don't know what should be done, what not to be done.